This is Cheryl Whitman from Beautiful Forever University. I'm very excited today to have Dr. Randolph Waldman with us, and lots of great information and pearls you will learn from somebody who is a master of the arts, master of rhinoplasty for one, and that seems to be his love, as well as noses and breasts. And the interesting that the younger generation is coming back in and wanting to have these services done. And truthfully, we just finished talking about the lifestyle and the life cycle of a patient. So if you have patients coming in their 20s, then what happens next? They need their Botox, their fillers, and then it goes on from there, and they bring their friends in. So that's a whole marketing program in itself. So we're going to share pearls today, a multi-specialty office and what goes on, and how Dr. Waldman and his staff do consults, and also cross-promote from a dual certified plastic surgeon to a medspa and to non-surgical. So really the surgical and non-surgical, as we all know, goes hand in hand. And most important that we're going to learn today is how to keep your schedule full. So I want to let you know a little bit more about Dr. Waldman if you don't already know him, but he's dual board certified. Facial and reconstructive plastic surgery and ENT for over 30 years. He looks really good. I don't know, Dr. Waldman, I don't know about 30 years, but so he's also known around the globe, and he's a leading expert in many things, rhinoplasty, blephs, chins, liposuction, neck, resurfacing, plus a whole lot more. Dr. Waldman has his own trade show, and he's known as a great organizer. I don't know, I think he must attend 45 conferences. So now he's sitting in his office and building his office happily in Kentucky at the moment. So Dr. Waldman, I'd like to introduce you to our audience and have you enter, and love to hear some of your pearls and information. And Lindsay will get on the screen our slides. So rhinoplasty in the multi-specialty office and keeping your schedule full is our main topic today, and I'm sure there'll be many other things that we could share.
Well, thanks, Cheryl. I appreciate the opportunity of speaking with you today, and it's really an honor. We've known each other for many, many years, and it's been a great relationship. So thanks again for having me.
Oh, you are very welcome. So today when we talk about I don't know, something's happening with the Zoom at the moment, but it will come back on, and it might be something with Facebook Live. But talking about the multi-specialty office and who, what, when, where, how, and why, what happens in your office being that it's multi-specialty, and you also have a med spa, which usually is more non-surgical?
Yeah, so we really have you know, a multi-specialty practice in that two of my partners are board certified plastic surgeons. I'm a facial plastic surgeon, board certified in that. And then we have a young associate who's also board eligible in facial plastic surgery and joined us about a year ago. So we have four of us in our practice. It's worked really well. I've had a multi-specialty practice now for 17 years. And I think we were one of the early practices to combine plastic surgery and facial plastic surgery. We share patients. We try to avoid any type of competitive situation. We all get along really, really well. We're all great friends, and it's a great practice. So I really enjoy every single day I come to this office. It's really a labor of love. So that's how we've done the practice over the years. In terms of sharing some pearls with you, we have about 20 employees in our practice. We try not to go overboard. We have our own surgery center, and I think that's a huge key. We've had an accredited surgery center for, I guess, 16 years now. That's a huge key because I know a lot of our colleagues were pushed to the side when there was kind of a COVID backup and even before that. But we control our own destiny. We're not controlled by any hospital or any big corporation that is putting pressure on us to do anything. We own our own operating room. We're the only people that use it. And it's really there as a convenience to our patients, and it allows us to control costs control the environment, and control the personnel. And most important, to have a private experience for our patients. And I should say a very private and safe experience for our patients. We use IV sedation in our center for every single surgery that we do, including abdominoplasty and liposuction, any type of breast reconstruction and augmentation, as well as all the facial procedures, facelifting and rhinoplasty, blepharoplasty, and brow lifting. And so all that can be done under a fairly heavy IV sedation. We have got great anesthetists, and that allows us to do that. So I think if I was giving any of the young surgeons tips for getting into practice, control your own destiny, try to control your schedule and your life, and most importantly, control your operating room.
And I think balancing your life with work and the trade shows, the combination, and you do a lot of training and education. What's the new hot topic that you're training in?
Well, I think, everybody's into the non-invasive and less invasive trends, Cheryl, but even in the meetings, and I've been honored to put together 46 programs now for major meetings around the country. And the trends kind of change every year. I remember all the way back when neurotoxins were a trend, way back in the early 90s. And I can remember when fillers were a trend in the late 90s and early part of this century. But certainly we've seen a little bit of a trend that the more things change, the more they think that things stay the same. And we've certainly seen, we haven't seen surgery go away like a lot of people predicted 10, 15, 20 years ago. I can remember when fractional laser resurfacing was the thing that was going to eliminate all other procedures. It was the greatest thing. And yet it's kind of faded now in favor of microneedling with radio frequency, which does some of the same things. But again, we haven't seen surgery disappear. And in fact, we're busier than ever with surgical procedures. And the current months, even in spite of being shut down for 6 or 7 weeks by government edict, we've not only made up ground, but we're running ahead, pretty well ahead of our numbers for 2019. And we've had 4 of the busiest months in the history of our practice. So things are going well in practice. I think for most of my colleagues, they've seen the same thing. People are at home, they've got time off, they're working from home, they can work with bruises and swelling. So that's given us a unique opportunity in spite of this horrible plague that's been thrown at us. So with everything that's bad, there might be a little good that comes out of it. And certainly our practices have seen that around the country, I think.
Which is great. Do you do any virtual consults or?
We do.
Yeah.
We do. I just finished one 10 minutes ago before I got on with you. And we did a lot of virtual calls when we were closed down and we couldn't see patients, at least in Kentucky, live. And so we did a whole lot then, but people want to see us. So now we're mixing in virtual consults with traditional in-person consults. And almost every virtual consult, I'm going to want to see in person anyway. So we automatically set up a second consult, an in-person consult, where I can get to know that person a little bit better. I feel like it's a lot harder to get to know someone in a virtual consult. And I want to know my patient. I want to know who I'm operating on. I want to make sure that I feel good about their expectations. And I want them to know me a little bit and understand my personality and what we try to achieve.
And that's interesting. So when it comes to doing a consult, and we know a winning consult is very important, do you do most of them, or do you have an assistant helping you with your consultations?
I always have somebody introduce me and credential me. And I think I've seen you even give lectures maybe on credentialing, the physician or surgeon, and that's very important. It's always great for somebody else to credential you I think, rather than me coming in and touting anything about me and that I'm the greatest thing. So I have somebody set it up, but yes, I do every single consult of anybody that I'm going to do a treatment on. And I feel like that's just something I feel more comfortable with. I know other people do it differently, but everybody, all the doctors in my practice do it the same way. We see every single patient before we do any kind of procedure on them, whether it's even an injectable procedure. We're the ones seeing them.
And what's the norm? I mean, it might be Kentucky, it might just be your practice, but what are they charging and how much time are you spending in a consult?
It varies. The virtual consults are pretty quick, and we actually, when this thing hit, we decided not to charge for virtual consults, so we try to do those at the end of the day. Whenever you don't charge for a procedure or a consult, your no-show or you're going to have cancellations more so. When we're doing a consult, we actually have gone to something to avoid no-shows and gaps in our time. And so we actually charge in advance for consults that we do. We had a point where we charged the discounted rate for our consults, and we charged a little bit more if they paid in person. But we found that the no-show rate or cancellation rate was almost zero on the people that paid in advance, and it was up to 30-40% at times of the people that didn't. So it's an effective way to screen people out that are real serious about talking to us and coming into our office. And so for us, that's how we do it now. Patients pay in advance a consult fee, and it's the same consult fee that we discounted before. We don't really try to make a lot of income on consults. We just want people to keep their appointments, and we know where our income comes from are the surgical procedures. So consults aren't a great money maker for us. So in our practice, all of the doctors will do a consult for $100. And I know that's not what is charged in a lot of the dermatology practices or it may be even some other plastic surgery practice. But remember, it's just, for us, it's a means to a goal. And our goal is to do surgical procedures. That's where 90% of our income in our practice comes from.
Which is wonderful. So if they paid the $100 to get the consult, which, as you said yourself, is not a lot, can they use that towards a procedure if they book something that day?
Yes, yes, it is. And we've always done that. We always say, well, we charge $100, but it comes off your surgical fee. And again, it's just a means to an end for us. We are not looking to really make money off of consultations. I just want to see the patients and talk to them. And we know that if we talk to a patient and we see them, that we have a pretty high rate of success in taking a consultation and creating a surgical procedure.
And after like 2,000 or more, I don't even know, maybe my numbers are not even right at this moment, of your rhinoplasties. I mean, you must have an amazing book of before and afters, and the word of mouth marketing is the best that you can do. You don't even need to probably market as much at this point. But how do you motivate patients to give you more referrals and reward them so they feel great about talking about you and your...
I think we just, we don't reward them with money or procedures. I think we just treat people the right way. And we, our patients, they're like friends to us. And I think Grant Stevens gave a talk several years ago, and it just stuck with me that it was true. It's like you want to create a patient for life. And you made a point that the rhinoplasty patients are relatively young. They're between the ages of 18 and 30. For the most part, there are people that are outside that range, both younger and older, but for most, they're 18 to 30. And, you'd like to have that patient in your practice forever. I see people now that I did the rhinoplasty on 30 years ago. It's really gratifying when you see a nose, you say, you have a pretty good nose. Have you ever had, Dr. Waldman, you did my nose 30 years ago. Don't you remember? Oh yeah, I guess I do. But, I just scratch my head. But yeah, they're there for a facelift, or they're there for something else. Or it's even more gratifying, Cheryl, when they bring in their daughter And it gets really scary when they bring in their granddaughter. So, you know, that's happened to me. You know, a few months ago, something happened to me that had never happened before. I had never done 3 siblings at the same time, not the same day, but within the same 2 or 3 week period. And 2 of them came in from another state, nearby neighboring state. And I did their noses. And the third, they called me, one of them came in for their 1 week post-op. And she said, you know, my sister was scheduled to have the procedure in South Carolina, and she has to pay, you know, she's dropping her deposit because she's seen our noses, and, you know, she's decided she'd be in better hands with you. And I felt a little bit bad because I know that one of my colleagues was scheduled to do that. I don't know who it was. I never asked, but somebody was scheduled to do that person's nose, got a deposit, had them on the books, and then they were up here within a few weeks after that. And we worked them into the schedule. So we ended up doing 3 sisters, and I had never done that before. I've done 2, but never 3.
That would be a great family testimonial and photograph before and after.
Yeah, it said there was a restaurant in New Orleans, I think, when I was in training, called 3 Sisters, or the Court of 3 Sisters, I think.
There is, yeah.
I remember that restaurant down there. And I said, well, so I always called these gals. I said, well, you know, we're creating the Court of 3 Sisters in West Virginia, as it was. So that was kind of fun. I had a great time with them. Honestly, I love what I do. You know, every day that I come to work, particularly when I'm doing noses, I have to tell you, it's my first love. But I was trained by the guy, he was a giant in our field, a guy by the name of Jack Anderson. I owe him everything. You know, he gave me the skills, or at least the knowledge. You know, I learned the skills in my surgical training, but he gave me the knowledge and the judgment. And he was truly a great artist. And, you know, so I give him credit for everything. But, you know, I was one of his fellows. There weren't many of us. And since my fellowship, you know, rhinoplasty has always been my first love.
No, which is great. Now, what if somebody comes in and they really are not ready for surgery? There are non-surgical options.
There are.
I know you're a surgeon and surgeons want to do surgery. I get that, and you're really good at it and you love it. That's clear. But what do you offer as an alternative for somebody who doesn't want surgery?
You know, a lot's made about the non-invasive rhinoplasty, which is nothing more than injecting filler into the nose. And there are some noses, rare noses, I think, that can be improved with fillers. I just, maybe a half an hour ago, I saw a young lady, and I'd done a virtual with her. And really, I thought that I could achieve augmentation of her nasal dorsum, which is the bridge of the nose. I thought I could do a pretty good job with just filler, and that would be an indication. This was a young lady that I don't know whether she was from Vietnam, but certainly her parents were. And I thought that that was an appropriate procedure for her at that point. But honestly, for the most part, I think that non-invasive or, you know, filler injections to the nose may be a little bit overdone. I think there's a great place for them with a slight bit of nasal dorsum. If there's a little bump in the nose and you want to camouflage it by injecting above and below that bump, that works to some extent. If there's a little asymmetry or collapse of the upper lateral cartilage, it works. You can fill out the side of the nose a little bit. If it's a little bit crooked, you can sometimes make a nose look straighter. But for most noses that we see, at least rhinoplasty consults, you know, the fillers and the non-invasive rhinoplasty is not the real answer. I understand that if the only tool in your toolbox is a hammer, that everything looks like a nail. That's an expression I like to use in the office. And I've got some other expressions too, but I don't know. It's like, for me, you know, we try to have all the tools in our toolbox. And somewhere in my practice, pretty much every tool exists in this practice. It may be one of my associates that has those tools, and that I pass somebody on to them. But we can pretty much do and we have all the toys and gadgets and lasers that are really needed in a multi-specialty practice. But, you know, to me, the effective practice has every tool in the toolbox so that you can offer the patient every option that's out there. I had another gal that came in a couple hours ago, and you know, she said, well, I've had liposuction in my neck a couple of times. Do you think it'll help? I still don't feel good about it. And I'm looking at it and saying, if the only tool in my toolbox was a liposuction cannula, then that's what that lady would be offered. But honestly, she needed a facelift. You know, she had lax skin now. She was 49 years of age. And really, if she's going to get the best procedure, it's going to be a face and neck lift and not liposuction. I talk about neck liposuction all the time. That's one of the, 10, 15 talks that I'm asked to give at meetings. But there's a place and a time for it. And it's an option that you give to people, but you need every option, you need every tool in the toolbox to really be an effective practitioner, or the ability to refer to somebody that has those tools. And so many times people get caught up into the type of practice where only one tool in the box and everybody gets the same thing. So in my mind, non-invasive rhinoplasty is one of those things. You've gotta, to me, non-invasive rhinoplasties are best done by people that actually have rhinoplasty skills, because we know what can and can't be done. We know what the best option, and we offer the patient the least amount that we can do. I always start, this is the least that I can do for you, but I always give them the option, and I tell them exactly what to expect. And we image and show them pictures and do all that kind of stuff as well.
Do you offer patient financing options if somebody comes in and they weren't expected to get a face and a neck lift, and now they realize that that's what they need? So do you offer the financing options?
We don't personally, but we deal with companies. One of the big companies, we all deal with pretty much the same big company, and we do a lot of business with them. A lot of business. I mean, it's definitely seven-figure stuff with that particular company. So we do have patients that finance these procedures, and I don't have any objection to that at all. But we don't finance it internally. We have a separate subcorp that deals with that. A couple of our younger doctors deal with some limited amount of third-party pay as well. But yeah, we definitely see some people that are financing these procedures at this point.
Yeah, I mean, right now, especially with some people out of work or their partners out of work, you want to make it affordable. And I know a company like Hair Credit, because I had interviewed one of their vice presidents, they talked about having COVID specials where people can pay it out over 2 years or 3 years, and it becomes affordable to everybody, because, what's affordable to us might not be affordable to somebody else. But we did get a question just now, I guess, when you were talking about the technology, and the question on when does it make sense to add new technology and new services to their practice, and how do they evaluate it to know to make it profitable? I mean, so from your point of view, I'd like to hear that.
It's always about the same thing, and you've lectured on this too, ROI. There are certain types of practices I could have. If I got a pulse dye laser in my practice, would it be really effective? How many hemangiomas and how much of the pigment or the vascular lesions am I going to see compared to, say, one of our very competent dermatologists here at Lexington? I'm probably not going to see very much of it. So the return on investment wouldn't be right for me with that particular piece of equipment. If I looked at even something like, we have hair removal, a hair removal laser, but we don't go gangbusters with it, because again, there are places opening up now that's all they do. And so if you're looking for return on investment for a hair removal laser, it becomes much tougher. And when so many people are doing it, then there's kind of a commoditization of pricing. So we look at things really as to, well, how much return on investment can we get? Can we make? Do we think that we can charge and bill out or enough that we can actually pay off the principal of that laser in 2 years? We don't believe in financing. If we can't buy something, we don't buy it. Everything is bought with cash. We're not doing anything on leases or loans. Our practice is 100% debt-free, and that's the way we've had it from the very start. It's just something that I grew up with, and something I feel more comfortable with. I feel more comfortable owning something rather than leasing it. I don't lease a car. I don't really lease anything.
And you're lucky to be in that position, but there's a lot of people who are starting up or expanding, and they really don't have much of a choice because they don't have what you've developed and grew into. So
a startup loan, I mean, I think that all of us did startup loans. I'm not saying that. And I give lectures. Joel Schlesinger always has me give an interesting lecture on what do you do if you've got $100,000? What's your best ROI? And he'll ask several different people that question. I think I have a very good answer for that on things that bring me a really good ROI. Our IPL does that. Our Surgitron does that. Our microneedling is off the board with ROI. We do really well with microneedling. We keep one room busy with microneedling all the time. And it's been the best. The ROI on microneedling with RF has been probably the best ROI on anything that we've ever bought. Fractional laser resurfacing did really well, but we've almost replaced fractional resurfacing with microneedling because there's no downtime with it. It's a 3-stage procedure rather than 1 stage, but still there's no downtime, and patients love that. So you just have to look at ROI and what makes sense for your practice. If you're a dermatologist, one thing may make more sense. If you're a plastic surgeon and you spend a lot of your time in the operating room, then it may be something completely different.
So how do you cross promote with your medspa? So your microneedling, would that be considered part of your medspa?
It
and
is.
physician or nurse?
Yeah, it is. It is. It's done by our, we employ nurse estheticians. And so we have RNs doing these procedures. And microneedling is one of the things that we offer in our medspa. Hydrofacial is popular. Various peels are popular. IPL is very popular. Hair removal to some extent. But the microneedling is really our top income producer, other than skincare products and that type of thing, of all of our procedures right now in the spa.
Well, that's good to know, because we hear, more and more people are training on the microneedling, and there's all levels of microneedling, all different types of, hand pieces and products. But we do see amazing results even with scars. Do you cross promote your surgical with a gift certificate or something to your med spa? Is there a pre or post program that you put in place at all?
There's not right now, but when you mentioned that, it's probably a great idea for people to do. We've not done it, but I can't give you a good reason why we haven't done it. So that may be something that you brought forth, an idea that I learned today, or I didn't learn it today, but maybe that's something we need to rethink, that we throw in something in the spa for everybody that has a major procedure. Now, what we do is I'm a big believer in Alastin skincare products. Full disclosure, I do have a vested interest in that company, and I think it's great stuff. I thought it was great stuff before I invested in it, because my wife is really picky, and she runs our spa, and she's probably the pickiest person. She's been doing skincare stuff for 25 years, and she fell in love with the Alastin products. And again, I'm not trying to push the product, other than say that we include that in the package with all of our facelift patients. It comes with it, because we think that they need to condition their skin in the month prior to surgery and in the 3 months after surgery. So it's just part of the package that we throw in. So yes, I guess with that we do. But I think it's a great idea. At one time we used to give, for all of our surgical patients, we used to do a free facial afterwards to introduce them to our spa. And then we started doing a free hydrofacial to introduce them to our spa. And I don't know why we've gotten away from that, but maybe after today I'll get back to that. I like that idea.
You'll have to keep me up on that. But the added value right now, and you keeping the life cycle of the patient, I think it all makes sense, to be able to include that and get them into your spa on a monthly basis, because they're not coming for rhinoplasties every month. So, now we've talked a lot about your rhinoplasties in our next slide. And, really, what does it take in hot topics that we talked about today? What does it really take to be a master? I mean, that's really, is it the time that you put in over the 30 years or your training that you talked about?
I think every procedure, every surgeon is better at something that they do all the time. I think it's very tough to be a rhinoplasty surgeon and to do 4 or 5 a year or something like that. And it's just a much different procedure. I think all of us in the field understand that it's totally different than doing breast augmentation. It's totally different than doing facelifting. There's really not much relation between the procedure and those procedures. So, you know, I would tell anyone that if I was choosing a rhinoplasty surgeon, it's somebody that has tons of experience. Then it becomes a judgment thing. You know, how did they train with it? How many did they watch or do during their training when they weren't working on patients in the practice? So training, experience, then it becomes judgment. And every surgeon has a different aesthetic judgment. I look at some websites and I look at pictures that people have on their websites post-op, and I don't like the result. And I'm thinking, is that the best they can put up? Well, it's probably they thought that was pretty good looking. And it wouldn't be something that I would want on my website. So the judgment of the surgeon, and we communicate with our patients through imaging, computer imaging. And all that does, it doesn't imply any guarantee, but what it does is it lets the patient know what we think looks good on them. And if we can't agree on what looks good, then we're behind the 8 ball right from the very start. So I think it goes to experience and judgment. There's a little bit of technical skill involved for sure. And, you know, there's a lot of noise right now about preservation rhinoplasty, and it's kind of a marketing tool that's been used mostly in Europe at this point. But there's a lot of people that have put names on different things, and, you know, the gimmicks will come up and, well, we'll just push the bump down rather, you know, we'll preserve this and preserve that. And, you know, most of us that have been doing this for a long time understand that there are a lot of ways to skin a cat, but ultimately the result depends on experience and judgment and aesthetic sense.
Yeah, and I guess you're a creative artist at heart. I don't know if you do any painting or sculpting, but it sounds like you're doing it every day in the OR.
You know, it's the most creative thing that we do. Honestly, I don't think anybody would debate that either. It's the most artistic thing that plastic surgeons do, facial plastic surgeons do. A lot of people don't understand that many of us that trained initially in otolaryngology, you know, most of us, the bread and butter procedure, and it's like a second or third year resident procedure, is a septoplasty. So we learn about the inside of the nose, we learn about blockages, we learn how to preserve the airway, we learn how to make people breathe better. A septal rhinoplasty really starts at the inside. The very first part of the procedure that I do is on the inside. And then we have to determine, are we just interested in changing the nose for a few months, or are we interested in changing it for somebody's lifespan? And so if you're going to change it for a lifespan, then you've got to put structure in to reconstruct that nose a little bit where you've torn down some of the supports just to do the procedure. And so that's called a structured rhinoplasty. That's what I was trained in. I don't think there's any substitute for that. I see people 35 years later. I've got an assistant that's worked for me for 35 years. I did her nose 35 years ago. It doesn't look any different now than it did 35 years ago. A lot of people know my longtime assistant, Paula, who you know, comes to a lot of the meetings that I do, and they've gotten to know her through that. But her nose looks the same now as when I did it. That's what you really want. You don't want it changing. So you have to put structure in. You have to make sure that you don't weaken the supports. And if you do weaken the supports, the tip supports, that you've taken care of that. And so there's some nuances to rhinoplasty that separate different techniques. And you know, I probably right now, I guess, by default, and it shows my age a little bit, I have the longest experience, I think, in the country. I can claim that with the external rhinoplasty. And that's 70% of the rhinoplasties done in the US are done by the external route. When I first started, Dr. Anderson really brought that technique into the United States. And guess who his fellow was? Right place, right time. It was me. And so I was honored to be his fellow. I was in the right place at the right time, but it also gave me now the longest experience with that procedure. Now 70% of the rhinoplasties are done by the external approach. When I started, 0% were done by the external approach. And you know, I can remember, Cheryl, and I'll just say this one quick story because I think it's something that you'll never see again. But I was Dr. Anderson's fellow, and I was 7 to 8 months into my fellowship. And, you know, I was looking around where I was going to go afterwards. And Dr. Anderson wanted me to go into academia. He felt there should be more facial plastic surgeons like me in an academic environment. So he came to me and he said, I've got this inquiry from Eastern Virginia Medical School. They want to interview you. I said, well, that's great. And so scheduled the interview. I wasn't finished with my fellowship, but scheduled the interview. I get up there, they wine and dine me a little bit. And on Friday night, I go to the chief's house guy by the name of Gary Schechter. And I'm saying these names so people that are on this thing that might remember that know that this is a legitimate story. The next day they went and dined at that time, my girlfriend and myself, now my wife of many years, Marianne. And the next day they want to show me the operating rooms at the hospital. So we go to the locker room and so, well, you got to get dressed before you go in, sterility and everything. And, that seemed normal to me. I trained at the Cleveland Clinic. We never went in the operating room without scrubs and everything. Go into the operating room. There are all these people in there and they were all crowded in, about 15 people. And I'm like thinking, well, these guys operate on Saturday at this place. It must be pretty busy. And then I'm thinking, no, maybe it's a trauma case. And I realize everybody's looking at me when I walk in the door. And I'm like, what the heck? What's going on here? And I look at and there's all these black and white pictures, 5x7s. That's how we used to do it back in the old days. And they're on the x-ray view box. And Dr. Waldman, this is one of our nurses. She's under anesthesia, as you can see. These are her pictures. We want you to show us how to do an external rhinoplasty. And there I was. And I'm thinking, okay, how am I going to get out of this one? I didn't understand licensure stuff. I knew I wasn't licensed in Virginia. And I said, well, what about licensure? Oh, we've covered that. We've gotten that taken care of. We've approved it through the governor or whatever. And I said, oh, can't get out of it that way. So I said, well, I need certain instruments to do the operation. And what I didn't know was that Dr. Anderson knew this was going to happen. He thought he'd play around with me a little bit. And they asked for a list of all the instruments that he used on his rhinoplasties. And so they had the whole tray set up. There I was stuck. And said, well, this is Dr. Roper. I don't even know if Dr. Roper is still around. His name was Al Roper, not the weatherman. And he was one of their staff guys, sat across from me. We did a rhinoplasty and it couldn't have gone more beautifully. I mean, it was just like, so take the wheel type of thing. Jesus, take the wheel. And it just couldn't have gone better. So do the rhinoplasty, did everything with it. And I get back to the hotel afterwards and my wife or girlfriend at the time said, well, how'd your day go? How'd it go with I said, it went good. I said, met a lot of neat people. I met a lot of the residents, did a rhinoplasty. She said, wait a minute, what'd you just say? I said, I did a rhinoplasty. And so a couple of years later, I ran into Al Roper at a meeting and I said to him, hey, I didn't take the job, by the way. They didn't offer quite as much money as I got in another place. But, I said, how's that gal doing? She loves her nose. She talks about you every day in the operating room here at Eastern Virginia Medical Center or whatever it's called. And so that was my very first rhinoplasty done outside of my fellowship.
So you were a star and you didn't even know it.
I just didn't have enough time to be nervous. And, I've always been a pretty confident surgeon. I had great training at the Cleveland Clinic. I owe those people a lot. But that was a moment that you'll never, ever see again because I don't think anybody can still do that.
No, I don't think so either. And it was definitely a long time ago. When we talk about the years going back, that's part of the culture that changed.
Yeah.
One quick thing that, we didn't expect to talk about, but when you talked about, somebody who's with you for so many years, I give you credit because it's hard to keep staff. And that's a whole other situation and a whole other conversation we won't get into now. But when you have staff starting with you, or you have staff with you 2 years, 3 years, and they want surgery or they want procedures, what's your rule of thumb amongst you? And
that's really a great question because that's always been an evolving thing and something that we've changed a lot over the years. When I first started doing it, you do a procedure and you hope that person would stick around. So it's kind of evolved. People have to work for me, and I'm not talking about injectable stuff because once people start working here, we're going to put them out on the front lines and we want them talking about their lips or their eyes or, whatever. But when we're talking about surgical procedures, our thing is that we have people work for us for a minimum of 1 year before we will put them on the schedule. And then they have to agree that they're going to work for us for another year to make that procedure complimentary. And that's a credit. We give them credit, and really we've had no problem with that. I'm really blessed to have a great staff. I mean, I was talking to my wife about that every day is a pleasure to deal with the people that work for me. They're fun, they're personable. We hire them that way, though. We hire people that are fun and personable because really, as you know, I don't need to lecture you on this. You're a marketing person. Everything we do, I mean, we're part doctor and part marketing practice. And everything we do, from our website to the way we receive our patients to the way our office looks, everything we do is in marketing. And so everybody that I employ, whether they're in the clinical area, they're in the OR, they've got to really have personalities and be able to interact with patients. We just don't hire people that we feel can't interact with our patients and make them feel more comfortable and to treat them the way that we would want to be treated. So every day I show up and you know, I love my staff. I really do. I think I have a great staff. Sure, at times there'll be problems and, you know, little petty things going on between employees and stuff. But, you know, I've heard people say that HR is the biggest problem. It takes time, but if you get a great staff, they can make your life so wonderful. If you get a staff that's not that great, or somebody that's creating too much drama or whatever, then life becomes a lot tougher. So I try to keep people that, you know, we avoid drama. They know that. They know the rules. We have policies and procedures, but, you know, usually everybody's looking out for our welfare, and all the doctors in our practice have a great relationship with every single employee.
Well, I give you a lot of credit because there's a lot of turnover in this industry. There's no question. And I do believe that it all starts at the top with somebody like yourself and your wife, and the way that you treat the staff. And I am sure that's why they stay for a long period of time.
Yeah, you know, let me butt in and say one thing about turnover. What we do, every single person that works for us, you know, has some type of advanced degree. We've always been that way. We recognize that a lot of these younger people who work for us, you know, maybe a pharma job is in their future. I've had, I don't know, over 35 years, I've had a number of employees that have gone on to take really good pharma jobs, even with some of the bigger companies. We're okay with that. I treat them like I do my kids. I want them to advance in the world. I don't want, you know, if somebody's just content with having a college degree and being a receptionist or, you know, a front desk assistant, and that's their end goal, then, you know, okay, we appreciate that. But for the most part, I don't know that their parents would appreciate that as much as I appreciate it. So we understand that that we're also a little bit of a training ground for a lot of people that are just getting into the medical field. Maybe they were a philosophy major in college, and this is an entry point. I've had a number of people that got college degrees. They started working for me in the front office, and then they decided to go to nursing school. They were so enamored with the nurses working here and the surgical aspect of things. And I'm totally okay with that. We've had some that go to nursing school and come back, worked in our front office. Now they're working in our clinical office. And so I'm all about people moving up the ladder. And again, I look at a lot of these young people that have worked for us as my own kids.
Yeah, I mean, you know, you're doing the right things and you're treating everybody like family, and I think that shows. And one of the key takeaways from today, well, there are actually so many on keeping your schedule full. You've given us so many great pearls. But is there one takeaway that you want to end with, since I kept you longer than anticipated, but it's been a wonderful chat with you.
Well, I would say I like the idea of a multi-specialty practice, first of all. I think that for a practice to get along with partnership, and I know so many practices just have not been able to do that, but you have to give and take a lot. It's like a practice is no different than a marriage. It is a marriage. I'm in this office probably more hours than I'm awake at home. And so there's a lot of give and take, and there's a lot of things, and there's ups and downs, but there's got to be a give and take. And nobody can, your partners all have to feel it's kind of like all for one and one for all. And we all have to, revel in each other's successes. And, I think that's the atmosphere that we have here. The same thing with employees. You treat your employees like family. your life will be much more enjoyable, because that means you're around your family all day long. And they may not be related by blood, but they're related by toil and work and work ethic. I'd say whenever you're getting equipment, just look at your ROI and don't get carried away by sales approaches. Remember, it's not about the tools that you use, but about the person that's doing it. We try to exercise judgment on every single patient. That I have a few phrases, and one of them is there are no shortcuts to quality, and I really mean that. I came from a snow cone place in New Orleans called Hanson Snow Cones, and it was something I got in my fellowship, but they had a sign, no shortcuts to quality, and I really think that's true. And if that's true in your own practice and you don't shortcut it and you exercise judgment on every single patient as if they're your sibling or spouse or whatever, we try to do that. And I think when you do that, you build up a name, and then things will flow into you. I think we haven't even talked about things like marketing, like websites. I think it's incredibly important. And that's the major marketing that we do in our practice, is just an effective website and effective before and after pictures. People often talk about what drives people to a practice. And we actually did one of these things that I'm on the board of, one of the online things. We did a survey, and we're trying to figure out what drives people into practice. And yeah, cost is part of it, but it's probably number 3. It's really, you look at reviews, and you look at websites and post-op pictures, pre and post-op pictures. So between review and pre and post-op pictures, those are things that people don't spend enough time on, and they need to spend more time on those 2 things than any other marketing that they're doing. So reviews and websites, and if you have a great website, you get some before and after pictures, and you build those up, you work really hard to get those. Then you should be successful in your practice no matter where you are. We don't pay for Google Words. We don't really, we have a company that works with us on our website, but it's more for technical things. And the only other key that I will tell you, we have a practice with 20 employees. We occupy about 12,000 square feet, I think. I own the building, which is a good thing, and I only did that 7 years ago. If I was telling people in today's world, I would say own your building. That way you control your destiny. And I wish I had done that much earlier. But I also think one of the keys, we have like 23 computer stations here, digital phones, we have all this technical stuff. And while I understand it, I don't make a living knowing about it. So I keep an IT person or a pseudo IT person on our staff for all the breakdowns that occur in our office every single day. And there's nobody that's called more than Sheridan, who also works with me on my meetings. But he's a great IT person. He's been with me for 13 years, probably the most valuable person in my practice. And he's like a son to me. I mean, because I got him right out of when he started working with me when he was in college. So some of you know Sheridan from the meetings because he helps out with technical stuff at the meetings. But the only other thing that I'll tell you that keeps us on the cutting edge, I think, is you asked me about the meetings versus the practice. I think the meetings, while it certainly takes some of my time away from my practice, if I had devoted all the time I spend on meetings 100% to my practice, maybe I would have, I don't know how I could be any busier than I am, but maybe, I don't know, maybe it would have meant money in my pocket in the past, but it's a labor of love with the meetings as well, because I think it keeps my practice on the cutting edge of what's going on. We see papers before anybody else does. We see abstracts before anybody else does. I deal with many industry executives that will tell me what's going on with their company and stuff. And I think the meetings have really helped keep our practice very current. It gave me the idea of a multi-specialty practice. It pushed me in that direction. Your involvement and other people, I've had the practice management portion of the meeting for longer than anybody else, Cheryl, and you were one of my early speakers. So 15, 16 years ago, we had, 100 people in a room, and, 5 years later, we had 600 people in a room watching practice management lectures, practice marketing lectures, and all that stuff. What it did is I went out and found people to give a message of what I was interested in hearing. And to me, that was the magic, because here I am, I've got the same problems and concerns as physicians in very similar practices around the country or even the world. And so what I put on the program are things that I want to hear. If I'm interested in it, then I know that the typical doctor out there has the same interest as I do. I did the same thing with practice management. And what it did is it allowed me to bring all that stuff home and to put it into our practice and to incorporate it into our practice. And I think that's been a huge help over the years. It's nothing easy about running a practice. Go to some courses, go to some meetings. Everybody does a little bit of it, but I'm going to put it, can I put a plug in for my global aesthetics meeting? The global aesthetics meeting coming up in April, we had to postpone it from November to April because I don't believe that there are just way too many virtual meetings, honestly. And I think people have virtual meeting fatigue. So we decided not to go virtual. We paid a little penalty to the hotel to move it to April. Fortunately, there was a spot. We're going to go live, and I feel confident that we'll be in great shape by then with a vaccine for healthcare workers, at least at that point, and pharma workers. And we'll have one whole track during the entire meeting just on practice management and marketing. It's that important. And bring your staff, because those are the people that want to hear this stuff and benefit from it. And so I take a number of my staff to every meeting. That energizes them, it rewards them. They get to go to a nice place, Las Vegas or Miami, but they sit there and they learn, and then we come back and we have roundtable discussions about what they learned and what we should or could incorporate into our practice. And it's an amazing thing. It's sort of like having a retreat and coming back from the retreat and saying, this is what we're going to do to energize our practice and to build our practice. And I do that every single year.
And you know what? That is an amazing pearl for most of the physicians who don't do that. Because I think by you doing that, that has helped you and your staff grow and develop. To go back, there were some meetings where I actually, after the practice management was over, at the very last day when people's heads were spinning, I actually put programs together over the years where, okay, let's talk about what you're going to bring back to your practice. How are you going to effectively do that and get the message out to your staff? Because not everybody has that ability that you make sound so simple and easy to get everybody together. My book that I wrote, Beautifully Profitable, was really written so people can open it up, pick a chapter or a column, and talk about that in a meeting for 15 minutes. Because some people don't even know what to talk about in a marketing meeting.
Yeah.
So I think you having these staff meetings, getting the staff involved, bringing home the information, sharing it with everybody, then implementing it is one of the key points I heard about your meeting just now that I think is wonderful. And not only do you run great meetings, and I have been involved for many, many moons, but bringing it home and bringing it back, I think that alone is an amazing pearl that I hope whoever's listening, and I'm willing to even do a webinar just on that, because that alone, and maybe with Aesthetic Authority, I could, now that I'm, contributing writer, I could do some webinar on that. But I thank you so much for all of your time and all of your great insights. And it's all very valuable. And I hope that there are some great takeaways that people will take and implement into their practice. And I look forward to seeing you maybe before April, but if not, in April in Miami.
Yeah, and if anybody has any questions, feel free to, can I give my email address? If people want to write me, they can. I can, it's just SR Waldman at AOL. I'm still an old AOL guy. Can't get rid of that address because everybody has it. So anyway, if people have questions or anything, I'm happy to, I don't know if I have all the answers, but I'm happy to try.
Well, thank you so much for your time today. And please say hello to your wife and your family for me.
I will. Thanks so much.
Thank
Appreciate
you.
it.